Everyone, I am Adesa Prado and this is for living in the IT era. So my topic for today is about a methods of contraception. So what is method of contraception? So methods of contraceptions include oral contraceptive pills, implants, injectables, patches, vaginal rings, intrauterine devices, condoms, which is the male and the female, sterilization, lactational amenorrhea methods, withdrawal and fertility awareness based methods. These methods have different mechanism of actions and effectiveness in preventing unintended pregnancy. So I have here 6 contraceptive methods I will present to you. The first one is this one. I know everyone is familiar with this, especially the mother, the women. This is a pills or the oral contraceptive pills. So, the oral contraceptive pill or OCP, often referred to as the birth control pill or colloquially as the pill, is a type of birth control that is designed to be taken orally by women. The pill contains 2 important hormones. These 2 important hormones are the progestin, which is a synthetic form of hormones with a progestogen and a progesterone. And the next one is the estrogen, usually the ethinylestradiol. When taken correctly, it alters the menstrual cycle to eliminate ovulation and prevent pregnancy. So, pills, this is a tablet form that will be taken for a woman within same 24-hour window of each day. So when it is taken correctly, it will alters the menstrual cycle to eliminate ovulation and prevent pregnancy. So the next one is the condoms. So condoms is very common. So this is a condom. Condoms are the only type of contraception that can both prevent pregnancy and protect against sexually transmitted infections or the STIs. So, condoms are the only contraception methods that can prevent pregnancy and can also protect against sexually transmitted infections. Condoms are made from very thin latex, or the rubber, polycyprine and polyurethane, and are designed to stop your semen from coming into the contact with your sexual partner. So, condoms stop the semen of the male from coming into the contact with their sexual partner so that pregnancy can be prevented. So, condoms has two types. So, the 2 types of condoms are the external condoms, are also called male condoms. These condoms are worn by the penis. And the second one is the female condoms. This is worn by the women in their vagina. So to understand what is female condoms, this is a female condom. Look at the picture. These are the female condoms. This is how to place the condoms. So, female condoms are made from soft, thin synthetic latex. They were worn inside the vagina to prevent semen getting to the womb. So, the female condoms, these be worn by the women inside their vagina to prevent the semen of the male of getting inside to their womb, so that they can not be getting pregnant. So the next one is the external condoms, or also called the male condoms. The male condom is a thin cover that fits over a man's erect penis. Condoms are the only method of birth control for men that are not permanent. So condoms are not permanent. It can be used only once. So when you are having another sex, you cannot use condom against. You should replace a new one. And then they can be purchased at most drugstores and vending machines, in some restrooms, by mail order, and at a certain healthcare clinics. Condoms are not very cost much. So condoms can be bought in some drugstores, in healthcare clinics, or in barangay healthcare. The next one is the implant. So what is implant? This is how implant look like. A contraceptive implant is placed under the skin of the upper arm. The implant releases a low, steady dose of progestational hormone to thicken cervical mucus and a thin lining of the uterus, the endometrium. So the implant typically suppresses ovulation as well. So contraceptive implants are a long-term birth control option for women. A contraceptive implant is flexible plastic rod about the size of a matchstick that is placed under the skin of the upper arm. So this is a contraceptive implant look like. It is about the size of a matchstick that will be placed under the skin of the upper arm. So it will be placed, look at the second picture. This is how the implant will be placed in the upper arm. So the next one is the vasectomy. So vasectomy is only for boys, or only for male. A form of male birth control that cuts the supply of sperm to your semen. It's done by cutting and selling the tubes that carry the sperm. So vasectomy has a low risk of problems and can usually be performed in an outpatient setting under local anesthesia. So vasectomy is only for male, a contraceptive method of a male, which there is a tube present there in their some part of their penis that will be cut or sealed so that the supply of the sperm will be cut and the semen will be cut, the supply of the sperm, so that they cannot, the girl will not be get pregnant. So the next one is the DMPA. So this is the DMPA. Look at the picture. So the DMPA contraceptive injection is a commonly used reversible contraceptive methods among women in the United States. Also known as the shot, the injection is commonly known and its brand name Depo-Provera or the Depo-Metroxyprogesterone acetate, or the DMPA. So it is administered once every 12 weeks or 3 months to be effective. So it is injectable in your arm, which is, you can choose the left or the right arm. The next one is the bilateral tubal ligation, or the BTL. So this one. A bilateral tubal ligation is a surgical procedure that involves blocking the fallopian tubes to prevent the ovum or the egg from being fertilized. It can be done by cutting, burning, or removing sections of the fallopian tubes, or by placing clips on each tube. So this is a ligation. This is only for women. So it is a surgical process. The fallopian tube, where the fallopian tube will be cut so that the egg will not be fertilized anymore. So they can prevent egg. So this is a permanent contraceptive methods. Either it can be done through the banded, the cauterized, or the tied and cut option. on how you decide to cut the fallopian tube. So I hope everyone have a idea and what are the contraceptive methods that is present in our modern world today. So that would be all for today, and thank you and God bless everyone.